Earlobe crease, wrinkles, predicts heart attack. According to studies, those having a diagonal earlobe crease, ELC, are nearly twice as likely to have coronary artery disease, CAD, and suffer a cardiac event as those who do not. ELC may especially signal a more severe form of heart disease for those already experiencing symptoms. A subset of individuals with earlobe creases, earlobe wrinkles, is predisposed to early aging and the development of coronary artery disease. In one study, the bodies of 300 deceased patients were observed, and Frank's sign was associated with cardiovascular causes of death. Another study found that an ELC in people younger than 40 was a sign of CAD in up to 80% of cases. Additionally, 430 patients with no history of CAD were examined for ELC and then had a CT scan for CAD. Those with an ELC were more likely to have CAD. The largest study to date, with almost 11,000 Danish participants followed for up to 35 years, found that having an earlobe crease was significantly associated with an increased risk of developing clinically significant heart disease. The chance of having a heart attack is also increased among those with a defined ELC, independent of other cardiovascular risk factors. Frank's sign is caused by the deterioration of the elastic tissue surrounding the tiny blood vessels that supply blood to the earlobes. The small arteries related to coronary artery disease experience the same kind of alteration. In other words, observable changes in the ear's microscopic blood vessels may be a sign of unseen changes in the blood vessels around the heart. However, some researchers called it a myth as they could not find any association between ELC and cardiovascular outcomes or the presence of coronary artery disease. Instead, they concluded that earlobe wrinkles are more likely a simple feature of the aging process in some people. Although ELC may be associated with coronary artery disease, its sensitivity for detecting this is nowhere near that of stress tests, CT scores, or angiograms. Nonetheless, the presence of ELC may be used to identify those at higher risk. They can be identified early and prognosis may be improved with early preventative interventions. Those with an ELC should pay close attention to the risk factors such as blood pressure and cholesterol, and take a proactive approach to prevent coronary artery disease, such as a healthy diet, active lifestyle, and measures to prevent the onset and progression of coronary disease. Thanks for watching.